introduce Dr. Jacqueline Miller. She will be giving us a presentation today on HPV vaccination and your dental partners. Dr. Jacqueline Miller became the State Dental Director for Missouri on August 1st, 2022. Dr. Miller brings an extensive history of leadership, advocacy for dentistry, and volunteerism both in Missouri and abroad. She has served multiple positions in the American Association of Orthodontists, most recently on its Council on Communication. In 2011, she was the first female to hold the office of President of the Midwestern Society of Orthodontists. She has made 24 dental mission trips and participated in Give Kids a Smile and Missouri Mission of Mercy. She is planning on continuing her overseas mission trips in 2023. Dr. Miller earned her DDS degree with distinction from the UMKC School of Dentistry and then was accepted to the University of Nebraska Medical Center College of Dentistry and graduated with a Master of Science and Certification in Orthodontics. In July 2022, she earned a Master of Public Health degree from A.T. Still University of Health Sciences. And she looks forward to using her experience in education to extend dental services to the underserved populations of Missouri, initiating programs to address these dental needs and to increase dental education to all Missouri citizens, partners, and stakeholders in improving dental health. So let's welcome Dr. Jacqueline Miller.
So just a little quick background. I am the State Dental Director as of 2022, and I just wanted to let you know that as our Dental Director, our office is committed to improving the oral health of all Missourians through education, prevention, and leadership. And this is a picture of our amazing crew along with our 5 oral health consultants that work around the state. So the reason that HPV is my favorite because it is the only vaccination that is prevention. It can actually prevent oral health cancer or oral pharyngeal cancer. And as a dentist, we all, I hope every one of you, when you've been to the dentist, that they've done a head and neck exam. And when I'm talking to the dentist, I really have been stressing to them, you know, as you're feeling around the head and the neck, that this is the time to be talking to people about vaccinations. And so what I want to point out to you as the public health professionals, that please reach out to your dentist. Call me, let me reach out to them, but we need to have a partner with our dental professionals, and we need to be working together to increase HPV vaccination rates. And so it's been a mission ever since I've started to talk to them and make them feel more comfortable about it. But what I want you guys to do is to, when you do see your dentist, ask them, hey, do you recommend the HPV vaccination? When they're doing the head and neck exam, are you talking about this? So everyone in here can make a difference when it comes to increasing vaccination rates because of just reaching out to the dentist and talking to them and saying, hey, if you don't feel comfortable with it, there's plenty out there that can educate you and work on this. So basically, that's one of my missions, is to get the dentist to be your partners when it comes to increasing vaccination rates. Unfortunately, when it comes to HPV, I don't know if you realize that every hour, 24 hours a day, 365 days a year, someone dies of oral pharyngeal cancer. That's how much it's raised in the last few years. It has just increased tremendously. And of those individuals, 43% will not survive longer than 5 years. And a lot of this happens because it's very difficult to catch these in an early stage because they're so far back in the oral pharyngeal area. So unfortunately, a lot of these cancers actually are high. And as you'll see a little later, oral pharyngeal cancers have actually surpassed cervical cancers when it comes to being caused by HPV. So just a real quick, it's way back in the throat where a lot of these form, and unfortunately, as I said, it's difficult to find these at an early stage. And you need to be your own advocates. You will have somebody speaking with you tomorrow. In fact, she was a friend of mine, and she felt a little lump, and she was in her 30s, and it was more or less a zebra, and she basically found out, I'll let her tell her story, but thankfully she was an advocate for herself, and she'll give you her story tomorrow. But we are finding it in younger populations. I mean, the majority of it is in older males, but we're finding it in younger females as well. So we really need to be getting in and talking about it. So here's some facts. 42 million Americans are currently carrying the HPV virus, and 4 out of 5 will be infected during their lifetime. And there are 13 million new infections annually. And there's actually 150 different strains of the HPV virus, but it's mainly number 16 and number 14 that cause the majority of the oropharyngeal cancers, otherwise known as head and neck cancer. Sorry, I'd like to bring that to a little more understandable. So head and neck cancers is mostly caused by HPV 16 and HPV and other ones. So those are the main ones. So a quick overview, most of you know this, but for those of you who are new, HPV is a very common virus. 80% of the population carries it. It causes 6 types of cancers, including oropharyngeal cancer. It's spread through intimate skin-to-skin contact. You know, most people talk about HPV and they talk about the fact that it's a sexually transmitted disease. We have got to get past that. We have got to be talking about the fact that it is in the majority of the population. We don't have to be talking about that it's passed as an STD. We need to be talking about the fact that this particular vaccination is cancer prevention. That's what we need to be focusing on, that it's a cancer prevention vaccine, and that everybody starting at age 9 should be receiving this vaccination. So we've got to just get past that and get through that, because I've talked to a lot of dentists and they're like, oh, I don't feel comfortable talking about that. Well, you don't have to talk about sexual practices. What you need to be talking about is the fact that this vaccine can prevent cancer in the future, and there's no other vaccine that can do this. So a couple of things you should know is that it does indeed cause, other than just oropharyngeal cancer, it causes cervical, penile, and anal, but HPV has become the leading cause of head and neck cancers. I've got to quit using oropharyngeal. I apologize for that. Frankly, it is mostly asymptomatic with the cancers themselves. So just a little review. And basically, how can an HPV infection lead to cancer? The body's immune system can't get rid of the infection, but it can linger over time, and it can cause normal cells to turn into abnormal cells. Does that happen to everybody who has the HPV? Absolutely not. Fortunately, it's only a small percentage, but none of us can predict what percentage, if it's you, if it's me, if it's whoever, whether or not we are going to come down with head and neck cancer. So that's why we need to make sure our vaccination rates are nice and high. About 10% of the women with HPV infection on their cervix will develop long-lasting HPV infections that put them for risk. And cervical cancer, when I was going through school, cervical cancer was the main cancer when it came to HPV infection. Nowadays, it's head and neck cancer. So actually, head and neck cancer has surpassed cervical cancer. And we talked about how it can be vagina, penis, anus, all of these, vulva, all of these can develop from HPV cancers. Fortunately, these cancers are much less common than cervical cancer, but we just don't know who's going to develop cancer in the future. Therefore, vaccination is our best bet. Every year in the United States, about 45,000 people are diagnosed with this type of cancer. And again, cervical cancer is the best well known. But if we have vaccination, and if we have high vaccination rates, 90%, that's 90% of these cancers can be prevented with vaccination, and there's not a whole lot of other vaccines that are, comparable to this. So we really need to be promoting this in our younger population. HPV and oral cancer. In one way it has gone up. And then when I was going to school, we were always taught that head and neck cancers were mostly caused by smoking and heavy substance abuse. Nowadays, it's HPV. So a lot of things have changed, so we need to keep up to date on a lot of these facts and figures, especially when we're talking to our dentists and our dental partners. So again, it's incredibly powerful. Even if, it's powerful on your part to have these in your back pocket. And what I have talked to a lot of dentists about is making a culture of HPV vaccination, making that part of their office. And I'm sure all of you have pamphlets about vaccination, and you want to make it a culture in your clinics of vaccinations. So, you have things out in the reception area and things in the room that people can read about. Make vaccination a culture for your area. So with Missouri, we're getting better. 59.3% in 2021 had their complete series, and for a national, we're 61.7. What's kind of interesting, though, is that these vaccination rates vary from state to state. Adolescents in HPV up to date in Mississippi they can be a low of 32.7% in Mississippi to a high of 83.2% in Rhode Island. Can anybody tell me why they think vaccination rate is so high in Rhode Island and some of those other states? Anybody at all? Schools are requiring them to vaccinate to get into school. So I'm not saying that that's necessarily anything we need to be looking at, but the states with higher vaccination rates, a lot of it has to do with mandatory vaccination before they get into school. And again, we are ranked 35th in the country for the percentage of all adolescents aged 13 to 17 who received all recommended doses. The good news is that yes, we are indeed heading in the right direction. It's getting higher as time goes on, but again, we are still not where we would like to be. When we look at prevention, HPV vaccination has been around since 2006, and across the world, over 270 million doses of the HPV vaccination has been given worldwide, and just 120 million here in the United States. And they continue to closely monitor to make sure that there's no downside to the vaccine, and there have been no serious side effects to this vaccine since 2006. So there's not a lot of vaccines that can say that, and again, that's what I really stress when I'm talking to, my goodness, I was just taking a walk with a neighborhood mom, and I looked over at her daughter and I said, "Hey, is she HPV vaccine?" And she goes, "Why, yes, she is. Why do you ask?" So as soon as I gave her some background on the HPV vaccine, she goes, "Oh." She goes, "I had no idea that it prevented cancer." And the other issue is I said, "Well, what made you decide to vaccinate?" And it was the fact that her physician said it was important. And we have that backed up by all kinds of scientific information. Even as healthcare workers, you're saying this is a good vaccine to take. If you're a trusted healthcare worker in that person's life, then they are going to vaccinate. It's the number one issue. So definitely give a nice, strong vaccination recommendation. So again, effective. More than 40,500 cancers can be prevented with this vaccine. Over 90% of the HPV cancers are preventable. And among teenage girls, this was a really neat study that was done in the United Kingdom. Over 88% of their cancers, their cervical cancers, went down because of the HPV vaccine. So you can imagine in the future, unfortunately in the future, when some of these cancers develop in our 40, 50-year-old, that these will hopefully be prevented in the future. And then, so it's safe. So just a real quick on vaccine administration, they are really, I won't go into it a whole lot, but usually in the previous time it was given at 11 or 12, but it can actually be given as young as 9. And the reason it can be given at 9 is we can actually find a more robust reaction to the vaccine and better coverage at an earlier age. So we might want to be looking at our 9-year-olds. And the other issue would be is there's a lot of vaccinations that are given as a bundle at 11 and 12. Some parents don't like that. So maybe if we start recommending it at the age of 9, not only will we have higher completion rates, we might also have that opportunity to say, yes, it's just a single vaccine. You don't have to worry about bringing them together. And then 2 doses, one 6 to 12 months after the first dose. And then those who begin on or after the age of 15 need 3 doses over a 6-month period. So again, what about recommending the vaccine a little earlier? Some studies have indicated an increased immune response, and earlier introduction may increase the likelihood of completion, and giving the vaccination, again, like I said, offers them more flexibility. What's kind of nice, if you do it at the age of 9, then you're not bringing the whole sexual connotation into it. It's just like this is a recommended vaccine at the age of 9, and we would like to recommend this. So real quick, HPV and COVID, it is projected to rise. Cancers are projected to rise. And dentists are your key players. So could oral healthcare professionals help? There's actually a study that just came out in our journal of from the ADA, and yes, everybody said that we can be helpful in increasing vaccination rates. Some barriers, it's the dental lack of knowledge, cancer screening guidelines. We need to do a better job of making this more accessible to our dentists. And there's a slide at the end that talks a little bit about whether or not dentists can hopefully vaccinate in the future, or at least write a prescription for this vaccination. And we need to have better communication skills. The American Academy of Pediatric Dentistry, as well as the American Dental Association, both talked about how we would be very good at increasing vaccination rates. So please take the time to reach out to your dentist. We are your partners. We're happy to help, and we'd love to help with this. I'll just go through this. When they're doing head and neck screenings, perfect time to be talking about it, and then talk to your pediatric patients. I'm going to go through this real quick. There was a Project AIM, and basically in this FQHC, in 8 FQHCs up in New Jersey, because of talking about HPV vaccination on the dental side, and once they used motivational interviewing, which you'll be talking about tomorrow, they used motivational interviewing and a vaccination champion, they were actually able to increase their HPV vaccination by 259%. So it was incredible how working together with our medical partners we're able to increase the vaccination. Objectives, spread awareness, the fact that you want to do it now, they were protecting, you want to engage with the patients and parents, and then follow up, make sure to get that 2nd and 3rd dose. So basically they identified a vaccination champion, and that was the one who worked very hard to use motivational interviewing with the patients, and they focused on 9 to 18-year-olds. And they used Show Me Vax, or another program, to identify who's been vaccinated, and then they went ahead and really focused on those kiddos that were not vaccinated using motivational interviewing. It's incredibly powerful how motivational interviewing can be utilized not only in talking to your vaccination hesitant parents. Believe it or not, I've started using motivational interviewing talking to my kids and my husband, and it's extremely helpful. I have 5 kids, and once I started learning about motivational interviewing, I got to admit, I haven't had a fight with them whatsoever. I just gently guide them and let it make, I want them to think that it's their own decision and that they came up with the right answer. So tomorrow, really take that one seriously, because motivational interviewing is excellent for addressing vaccination hesitancy, and again, it's very helpful in our home lives as well. So just, you ask, may we talk about, and it's the same thing that Dr. Miller was saying this morning, may we talk about this? And if you're shut down on it, then fine. Make a note in their chart to chat about it at the next appointment. And then inform, and then reflect. Let me see if I understand your concerns. Super ability to do the motivational interviewing, and it will be incredibly impactful once you learn the steps. So again, vaccine hesitancy. There was actually a study that came out determining parents' level of hesitancy and targeting. So basically, if you take the time to learn where their hesitancy is, you can almost customize your responses and the information that you would like to give to them. So you have to ask for their input. Are they hesitant because they're worried about safety? Are they hesitant because you haven't given them a recommendation? Where is their hesitancy? And then you can zero in on that and be able to address. Messaging, you should have in your back pocket every answer to almost every question you can think of as a parent or a caregiver. Why are you recommending this for my son? Well, the fact that it's recommended for both women and men, because both women and men, believe it or not, the virus does not distinguish between men and women. So we need to make sure that we're recommending it for all. Is my child too young? Absolutely not. Is the vaccine expensive? That's when you start talking about ways they can afford it, and for the other systems we have. Luckily in Missouri, of course, we have a vaccination system where they can get low cost and free vaccines. We're very thankful for that. Again, what about the parent questions? You need to have it, and in fact, throughout your entire office, it's a really good idea to have come together, write down what the answers are, and make sure that everybody's on the same page when it comes to answering questions about the vaccine. You want to make sure that the person at the front office is giving the same information as the person who's actually giving the vaccine, that type of thing. Make sure it's throughout the office. Again, if it's possible, as dentists, we would love to collaborate with the physicians. At this time in Missouri, we are not allowed to give vaccines as a dentist, and we're not even allowed to prescribe vaccines. We're hoping that will change with time, possibly with some things that are going on in the legislature right now, but we need to collaborate because ideally, because 70% of oral and pharyngeal cancers are caused by the HPV vaccine, we need to be stepping up. As dentists, we need to be stepping up. And I'm hoping each and every one of you will talk to us about it and say, hey, you need to be taking your part in this. And then hopefully we'll be able to prescribe in the near future. Provider communication flow sheet. The first thing you need to do is make a strong recommendation. If they say yes, then go ahead and vaccinate, or refer them to wherever they need to be to receive that vaccine. If they say no, then that's where the motivational interviewing will come into place, and then they talk about different techniques. There is, believe it or not, as dentists, we do have a national HPV vaccination roundtable, and they do know that we can provide an important role in cancer prevention. We need to refer patients if they're interested in the vaccination, and we need to educate as to what this is all about. We need to engage, and we need to collaborate. We need to be collaborating with each and every one of our clinics and chatting with them that, hey, if I, chat with my kiddos, can I send them your way for vaccination? And hopefully, either back to their primary care or to their local public health clinics. What are the ways we can increase vaccination together? Here's the House bill. The House bill was 249, the Senate bill was 270. The House bill didn't get a lot of traction, but the Senate bill did seem more positive, and I am hoping that with Senate Bill 270, what we're hoping is that we as dentists would be able to administer and prescribe vaccinations, of course including the HPV vaccine. From what I understand, it might get some traction and possibly be rolled into another bill, and then that would be just incredibly powerful from the dental standpoint, because then we'd be able to prescribe the vaccines. Frankly, I don't know of a whole lot of dentists that would like to actually give vaccines, but at least they have the opportunity to do so. So I am going to continue on here because I know I'm running a little short on time. Educational materials. At the Office of Dental Health, we have all kinds of free stuff. I mean, a ton of free materials. Our website has all kinds of materials that you can download. It was really pretty exciting. I went to our local fair, and there was the Franklin County Public Health was there, and they had one of our sheets there. I was so excited that they were talking about dental health, so that was fantastic. And we're more than happy to provide and send out anything you request.